Hi, my name's Krishna. I'm a spine surgeon and I work at the University Hospital of North Tees in Stockton-on-Tees in the UK. I want to talk to you in this video about an operation that we commonly use to treat low back problems. The operation is called a posterior lumbar interbody fusion. In the previous video, I explained the causes of back pain and the common non-surgical ways of treating it. There are some surgical options to treat back pain, and I want to talk you through them in this video. This is a model which explains the posterior lumbar interbody fusion procedure. Basically, the causes of back pain, as I explained, are a painful disc which, when loaded, causes pain. In addition, at the back of the disc, you can have pressure on the nerves. Where my pen is here is normally where the nerves come out of the back of the disc. So if a piece of disc is pressing backwards, you can get leg pain as well. Now, at the back of the spine, you have these joints, which we call facet joints. So the spinal segment consists of the facet joints at the back and the discs in the front. There are 2 facet joints and 1 lumbar disc. The aim of this operation is to replace all these 3 structures and remove the pain generators in the spine. So the key principles of surgery here are to remove the pain generator, which is the disc and the facet joint, to free up the nerves as they come out of the spine, and to restore normal loading across the spine by putting something in the disc space, and to restore that ability of the disc to absorb shock, like a shock absorption effect. So let's start with how this operation is performed. You do the operation from behind. These are the knobbles of bone in the back you can feel when you put your hand in the back, and these are called spinous processes. So you have an incision in the skin just above that. You free up the muscles and you take them off the back of the spine. Then you put these screws, which we call pedicle screws, into the vertebra. They go down this pillar of bone here, which we call the pedicle, and that's why they're called pedicle screws. You put one screw above the disc and another screw below, and they're connected with a rod. And you can see that you have one on either side, so you'll have 4 screws and 2 rods if you're doing a one-level operation. We then take out these joints you can see at the back, the facet joints. That gives us access to the disc in front. We take out the disc from behind, and all this bone that we get from removing the facet joints, we chop up into tiny pieces. We pack this bone inside these scaffolding cages, I call them. They're made out of a special material called carbon fiber or polyethyl ketone, and they're completely biocompatible. So the bone is packed inside the cages and in between the cages as well. That restores the load-bearing capacity of the disc, restores the height of the disc to normal, and allows us to remove the pain generator, which is the disc. And lastly, we just compress the construct over these rods and screws. Now, the common questions that patients want to ask are, how successful is this operation, and what are the risks involved? By and large, I'd say that this surgery is a quality of life operation. It's not life-threatening. It's not a life-threatening problem, and in most cases, the surgery is not essential. You should only have the surgery if you've tried and failed the non-surgical techniques that have been recommended to you. These were discussed in the last video. The surgery in most cases has a very good chance of leaving you much better than you were, but the success of surgery cannot be guaranteed. This is because our understanding of pain and its mechanisms is incomplete. Now, the risks of surgery are very analogous to driving a car. Most of the time your journey is safe and people do well, but there is a chance of having a problem, and the range of problems ranges from the very minor to the very serious. So the minor problems we encounter are infection, nerve injury, and leakage of spinal fluid, and they occur in 3 to 4% of patients. Further treatment may be needed to deal with any problems that arise, and rarely, of course, you can be worse off as a result of surgery. Now, there are rare catastrophic risks possible, like death, stroke, paralysis, bladder problems, but they're really similar to dying in a car crash. Really rare, but possible, and need to be mentioned to complete the list. You should only have the surgery if your quality of life is significantly impaired and you've tried and failed the non-surgical techniques available to help you. Now, this is just a general overview of the surgery. The particular details should be discussed with your surgeon. If you have any further questions, you can email me through the website or come to one of our spinal support group meetings where you can meet and talk to people who've had the surgery done. Thank you.